Hello, everyone. I'm going to talk to you about breastfeeding and different positions of breastfeeding for mom and baby. First, I'm going to give some insight on breastfeeding that would be beneficial for new breastfeeding moms or even moms who have breastfed previously but may have some questions or some things that they did not know. I will call them fun facts about breastfeeding. These facts were taken by World Health Organization. Breastfeeding is one of the most effective ways to ensure a child's health and survival. Breast milk is the ideal food for infants. It is safe, clean, and contains antibodies which help protect against many common childhood illnesses. Breastfed children perform better intelligence tests and are less likely to be overweight or obese, and also less prone to diabetes when they get older. Women who breastfeed also have reduced risk of breast and ovarian cancer. Some may wonder, how do I know if my baby is getting enough and being well nourished? HealthyChildren.org has given us some key things to look out for. Baby loses no more than 7% of birth weight first few days after birth before starting to gain weight again. Baby having one or two bowel movements a day. For the first and second day, at least two black tarry stools should be produced by the baby. Days 3 and 4, at least two stools that start to look like a greenish yellow color. Days 5 to 7, at least 3 to 4 yellow and loose stools with small curves like CD-like should be produced. Once milk supply is in abundance, it is possible for a baby to have at least one bowel movement after every feeding. 6 or more wet diapers in 24 hours is a good thing. And the baby seems satisfied and happy on an average of 1 to 3 hours between feedings. Um, Newborns need to feed 8 to 12 times in a 24-hour period, which is good for baby and signals the mom's body to produce making more milk. So these are some fun facts that I have for you guys regarding breastfeeding. Now to the positioning. First, we're going to talk about the cradle hold. The cradle hold is the most classic breastfeeding position, also known as the Madonna hold, where you cradle your baby against you while you nurse. The importance of this position is to make sure your belly is belly to belly with you and positioned just below your breast. You can either cradle your baby with your arm or bring a little support with an extra pillow. And you can consider using your free hand to hold and shape your breast to guide your baby to latch on like a champ. The pros of this position is familiar to replicate and easy, so you can bust out anytime and anywhere. The cons of this position is it may not be the most supportive position, especially for a newborn or a preemie. In this case, we have a 7-week-old, so she's pretty good at that. Next, we have the cross cradle hold. This hold is also like the regular cradle hold. To get into this position, make sure your baby is belly to belly with you and then support them across your back with an arm opposite the breast you're feeding from. Don't forget to bring the back up hand for some breast shaking action. You can even shape it into a C or U and hold it to help baby latch better. The pros of this hold is its more supportive version of the cradle hold. It's extra helpful for younger babies who need some extra support in breast shaking. The cons of this hold is it can be physically taxing to support your breast for extended periods of time. So if your arm feels like it's about to fall off, don't worry. It's totally normal. Take a break and come back slowly. Next, we have the football hold. In this hold, you'll be holding your baby snug against one side of your body, slightly below your breast area, and gently moving them towards your breast. Their chin should be touch the lower part of your breast as they latch on. The pros of this position is it's great for babies who need extra support, and it gives you a front row seat to your little one latching on like a champ. The cons of this position is sometimes it can feel foreign or difficult to manage. But don't worry, practice makes perfect. The next position we have is a sideline position. This position helps at nap time.
It's like a cozy little breastfeeding slumber party. Position your baby slightly below your breast facing you and snug up to your baby. Latch on as you normally would. The pose of this position is perfect for tired moms who need a break. And it's great for nighttime feedings to help you and your baby drift back to sleep. But be sure if you fall asleep, put the baby back in a safe position. It may take a few attempts to get the positioning right, but don't worry, practice makes perfect. The next position we have is a laid back breastfeeding position, also known as biological nurturing. This position is like a breastfeeding trip using gravity and your baby's natural instincts to get the job done. First, you will find a comfy spot, either a recliner or a pillow, and get in position by leaning back and letting gravity do its thing. Place your baby on their tummy against your belly just below the breast, and then your baby's natural instincts will take over. They'll be rooting and scooting their way to the perfect latch. The pose of position is perfect for those with newbie nurseries or any little ones who need a little extra coaxing. If you're feeding twins, this may not be the position for you. The final position we're going to speak about is the koala position, which is upright breastfeeding. For this demonstration, our 7-week-old is not big enough yet to spread her legs to straddle the mom's leg. But if she was, your baby straddles your thigh or hip, sitting upright as they come to the breast like a koala prayer position. The pose of this position is great if a baby has reflux or they're dealing with overactive letdown. The cons of this position, it might take a little practice to get the hang of it. So those are the positions. Those those breastfeeding positions were referenced from mixology.org for future reference. Also, I wanted to put a little side note in there, just as a breastfeeding mom previously, for those moms who are big busted, have larger breasts, it's very important to ensure that you move your breast out of the way when feeding your infant. And then, like I said before, that if you do fall asleep, be sure before you actually fall completely asleep, you move your baby from the bed or positioning to a safe sleeping environment. Thank you everyone for watching my breastfeeding position video.